All right, it's 5 p.m. Good evening, everyone. Thank you so much for your time to be here. And thank you those who are watching recorded video. My name is Salem, and I'll begin my presentation on promoting occupation-based intervention in hand therapy setting, especially for the OT students who are interested in hand therapy or are assigned to an outpatient hand therapy settings for the fieldwork education. Let me just double check if, all right, good. So this is the overview of today's presentation. First, we'll briefly cover history of hand therapy and we'll define what hand therapy and what certified hand therapy is. And we'll explore common diagnosis, interventions, and outcome measures that are currently being used in hand therapy field. After that, we will go over some of the essential components to promote occupation-based interventions in hand therapy. We'll do some literature reviews on what is currently happening in hand therapy field as well. Lastly, we will go over how to create a personal ADL toolbox and share a chart that can be used as a guiding and self-assessment tool for occupation-based intervention in hand therapy settings. Before we begin, I'm curious why you guys are interested in hand therapy. Or maybe this is a good time to think about when your interest in hand therapy began. I'll share my story first. I experienced numerous boxer's fracture on both my hands, um, and this resulted in decrease of range of motion, especially on my fourth and fifth upper extremity digits, as well as decrease in grip strength. My case wasn't severe, so it didn't have significant impact. However, it is still affecting me when I am performing different activities of daily living or some leisure activity, that those are meaningful for me. And I wish no one else to go through this experience. That is the first reason why I'm interested in hand therapy. Second reason why I'm interested in hand therapy is because of this advancement of technology and changes in our working environment. As we all know, we spend a lot of times using our smartphones or personal electric devices. And this is becoming a reason for increased incidence of different upper extremity pathologies and disorders, especially from this working population who spends a lot of time typing and using different electronic devices. So I want to help this population as well as their improved quality of living as well. You guys could definitely share your reason of why you're interested in hand therapy through the private message, through the chat. And later, when we have time, we'll go over those with some other questions as well. The history of hand therapy is much younger than the occupational therapy history. Few points that I want to highlight through this timeline is that the first organization for hand therapy, the American Society of Hand Therapists, were found in 1975 in San Francisco, California. Through the 1980s, there were some conflicts between the members of American Society of Hand Therapists and non-members because of some of the quality of care and with some other antitrust law on various healthcare organizations. This resulted to form a to form the hand therapy certification commissions in 1989. And this organization was found to ensure the certification program without any biases. And finally, in 1991, the first ever hand therapy certification exam was administered. And that is going to be one of the exam that every certified hand therapist must take in order to become a certified hand therapist. So what is hand therapy and what is certified hand therapist? So the definition of hand therapy is the art and science of rehabilitation of upper extremities. This includes your hand, wrist, elbow, and all the way to your shoulder girdles, all parts of it. And the hand therapy uses specialized skill to prevent any dysfunctions, restore function, as well as reverse some of the progression of upper extremity pathologies to enhance an individual's ability. Certified hand therapist is a nationally registered either occupational or physical therapist who became proficient in treatment of upper extremity diagnosis or pathology or conditions caused by different trauma, overuse, stress, etc. So in order to perform hand therapy, an individual must own a certification of hand therapy. Let's check some of the or all the requirements to become certified hand therapist. First, you need to graduate from an accredited occupational therapy or physical therapy school or program. And you must be registered and licensed occupational therapist or physical therapist, meaning you have to pass the board exam. After that, an individual must have minimum of 3 years of experience under the license of either OT or PT. In addition to that, there must be a 4,000 accumulated hours of direct supervised practice from other certified hand therapists. Any hours that was accumulated through temporarily or any volunteer hours cannot be counted. So try to remember that. Lastly, once you met all these requirements, then you get the chance to register for hand therapy certification exam. So after you graduate from OT school, and let's say you pass the board, you cannot just um, apply to or register to take hand therapy certification exam, but these are going to be the requirements to even register to take the hand therapy certification exam. So keep in mind, I know we're all worrying about how to be what to do after we graduate, but if you're interested, make sure plan your strategy right. So as soon as you pass your board exam, maybe you can already start working at the hand therapy clinic and start accumulating those 4,000 hours while you're gaining your experience as an OT as well. Now we're going to talk about the typical setting for hand therapy, especially for outpatient hand therapy settings. You'll most likely sit face to face with your client in front of a desk or table and chairs. And unlike some other settings, the space of hand therapy setting is quite limited. It's not very spacious. From my experience, almost, I'll say 75% of treatment was done on top of the either table or desk. So This is gonna be one of the challenge at first when you're going into a hand therapy setting or for your fieldwork education. This is where your creative mind needs to really work because everything will be done on top of the table. However, don't limit yourself when you're planning your treatment with your clients because we can always use what is available in the clinic. So don't plan everything that could be done just on top of the table. From my experience and when I talk to other OT students who done their fieldwork educations in hand therapy setting and from my windshield assessment from different locations of hand therapy clinics, I could already tell the overall size of the clinic was always about the size of the small office setting. My location for my fieldwork education was about 25 feet times 40 feet. Um, and even on with that limited space, half of the other side of the office was used for other treatment. So there will be some limitation. However, um, OTs, we are creative. And then with the tool that I'm going to explain later, we'll try to thrive to promote some of the occupation-based interventions as well in the hand therapy setting. All right, next, we're going to go over some of the common diagnoses that you will likely to see in hand therapy setting. Not everything are on this list. This list was a result from a decade-long study from Dr. Takata and his colleagues. Give me just one second. All right. So arthroplasty, some of the replacement of the joint, not so much of an amputation that you guys will likely to see. I've never seen one, burns, carpal tunnels, and the list goes on. From my personal experience, carpal tunnel syndrome, a lot of fractures, also tennis elbow and thicker veins and some of the nerve and tendon injuries from cooking was common, as well as some work-related pain also. So these are some of the diagnoses that you guys want to be familiar with prior to starting of your fieldwork education. You guys don't need to know every single diagnosis that are common in hand therapy setting, but have some ideas and have some planning already so that you already feel prepared when you're asked to create some of the treatment plans. Next list shows the common interventions that are being used in hand therapy setting, client and caregiver education throughout all different settings. That is one of the common interventions that we OTs use. Therapeutic exercise, manual techniques, physical agent modalities, and orthosis, prosthetics, and occupation or activity-based intervention as well. So these are the list um, of the common interventions. From my personal experience, first four, the client and caregiver education, therapeutic exercises, manual techniques, and PAMS were used mainly in the hand therapy settings. And this was where I felt like, we're occupational therapists, but I don't feel like I'm actually doing anything similar to what I learn, or this feel like more of a physical therapy type of a job. Next, these are the common outcome measurement categories that are currently used in hand therapy setting, starting with body structure, body function, pain and symptom, and functions and performances, quality of care, and behavior. So body structure is when we are observing some of the healing process of cutting or post-surgery suture and swelling or any deformity caused by either injuries and diagnosis. Joint function is when body function is when we check joint mobility, range of motions, strength, and sensation. Pain and symptom is simply pain level, edema, and some other symptoms that are caused by the diagnosis. Function and performance are mainly from how the client is adapting into different occupational performance, functional status, and quality of care is when we check when the overall experience was of hand therapy was checked from the client's perspective. Lastly, behavior is when we check our client's anxiety level or their compliance level to hand therapy, or um, when we perform assessment on their quality of life after the diagnosis that they have or injury that they have. Small tip that I want to share before we move on is make sure review some of your range of motion measurements for your hands. I believe maybe I wasn't paying so much attention during my time, but some of the measurement of the hands or joints and our fingers, wrist were quite different. And some fieldwork educators might have different approach. So definitely on your first week, make sure you go over how to measure some of the range of motions, grip strength, different sensation, assessment for sensation. Go over those with your fieldwork educator if they have not, because they'll be very critical when it comes to preparing and the whole process of the hand therapy. So I'm keep talking about occupation-based intervention. So I think this is a good place where we need to define what it means to be based versus center, so that we can continue our presentation here. The comparison between center versus based was actually done by Dr. Fisher, and her definition will help us to understand this concept. When something is being centered, it means that that something is going to be the centerpiece of everything. Whereas when something is based, we use that something as the main ingredient to function the centerpiece. Now let's apply this term. So, which means the occupation-based intervention focuses on client-centered approach while using occupation as a main source of intervention because it's an occupation-based intervention. So we're using different types of occupation or occupation-based interventions to help our client to either restore some of the functions or to prevent some of the dysfunctions as well. And this concept is going to be really important in terms of the definition wise when we are keep emphasizing or in promoting the use of the occupation-based interventions in hand therapy. One of the most important concepts when it comes to occupation-based intervention is activity analysis. Here is the simplified version of each step of activity analysis. I'm pretty sure you guys already went through this concept in your biomechanics class. Maybe I am confused a little bit here. It's been quite some time. But activity analysis is really important because the process of the activity analysis addresses different steps or the sequences of an occupation or activity. And this includes various range of different skills and physical performance of how an occupation is done. And in addition, knowing each step to execute an occupation can really help you to identify the challenging point of your client. And this will help you to um, help you where your treatment plan should really focus on based on their challenges. On top of that, some of the some of these challenges could also help you to come up with different types of grading. So grade up and down is another concept that will be frequently used throughout your OT career. So let's talk about this grade up and down feature. You could sometimes do a observation to understand, oh, which step or sequence are the challenging point for your client. And this moments is where you're going to write those down and try to come up with how to really help your client. And using this grade up and down, we can also naturally apply just right challenge for your client as well, because we don't want to discourage our people in rehabilitation process. I think I already shared majority of the topic that I wanted to share for this slides, but why don't I use some examples to use grade up and down and activity analysis. So I'll use a paper cup and a plastic cup. Paper cup is much lighter in terms of weight. Plastic cup is slightly heavier. So if a patient is currently suffering with limited range of motions of right upper extremity due to, let's just say, a fracture, that instead of just doing a reaching exercise with a small ball or some sort of a target to point at, we can basically ask the patients to, hey, like, could you reach for that cup from the distance to reach? And could you try to take a sip? Or they could just even dab the water on their lips without actually drinking it. And we can also change that from lighter to heavy weight, or change the amount of the weight by adding more water or not. Or we can even grade it further up by adding more tasks to the client by, hey, could you pour the water and then try to bring it to specific location across the table? Or we can even add an indicator mark to ask the patients to pour to specific amount and then bring it to certain location and bring it back to drink the water out of the cup. So this is just one simple example to replace a simple reaching exercise to an occupation-based intervention. All right, let's talk about some of the reality of occupation-based interventions in hand therapy. Unfortunately, there are limited research and gaps in literature on occupation-based practice, interventions, assessment, and practice model. On top of that, there is actually decreased use of occupation-based interventions in hand therapy setting. And many students, OT students, demonstrated lack of knowledge in applying occupation-based interventions in their practice during the hand therapy fieldwork education. This is what is currently happening, and I was actually really sad to find this out, but and also had a question. Does this mean occupation-based intervention is not effective compared to other intervention choices? So I did some literature reviews, and let's try to look at the result together. Oh, before we go into that slide, this is the some of the findings from Dr. Takata and his colleagues. So the number of the just overall study in hand therapy is getting quite low and low as each year passes. And among the small amount of these studies, activity-based, not even occupation-based interventions are currently being studied or being um, compared to other interventions. So this is how limited resources and researches we have currently in the hand therapy settings. So going back to some of the benefits of the occupation-based interventions when compared to other interventions, they're equally effective in improving range of motions, strength, pain level, and even edema. Patients also Patients with upper extremity musculoskeletal disorders, they studies found out that there's an improvement in occupational performance and some of the measurements of the upper extremities with the occupation-based interventions, and there was decreased in physical impairment and occupational limitation as well when occupation-based interventions were used. And surprisingly, the recovery time to return to activity of daily livings, different routines of individuals going back to work and participating back into their meaningful activity was much shorter when occupation-based interventions were used. Lastly, patients demonstrated increased interest, motivation, satisfaction, and their tolerance of hand therapy as well. So all these results from these studies shows that occupation-based intervention is equally effective when compared to other interventions that are currently being used in hand therapy. Some other barriers for occupation-based interventions is definitely limited time for fieldwork educators to manage both caseload and supervision for OT students because the nature of occupation-based intervention requires little more preparation time because of using different ADL tools and whatnot. So there are some limited time aspect. And some of the occupations are done differently by client to client or even compared to a therapist. And some of the meanings of occupation is slightly different too. So there are some conflicts and confusions when it comes to understanding a occupation as well. Limited space, we already talked about it earlier when we talked about the typical settings of hand therapy. Not only that, there are limited materials to perform or practice occupation-based intervention as well. And that is the reason why I believe that having a personal ADL toolbox is not even optional, but it should be almost a must for those OT students who are assigned to go to hand therapy settings for fieldwork education. And there is a lack of knowledge translation from our previous certified hand therapist to the current one. And as a student, like us, when we're in the fieldwork education, we're not really learning much about occupation-based interventions in our fieldwork rotation. So all this is actually becoming a complex barrier to use and practice occupation-based interventions in hand therapy. Okay, so now I'm going to share some of the tips that I found out during my fieldwork education on how to create a personal ADL toolbox or activity of daily living toolbox. For me, I thought about what are the ADL items that I used everyday basis, starting from toothbrush, spoon, fork, cup, smartphone even, and a organizer or container where I could carry them around for my treatment session. So make a list of your ADL items that you use every day because your client will most likely use them as well. And starting creating the list and then adding one by one into your toolbox will be the first step. Okay, safety check. So remove any items that can potentially harm you or your client or other clients. So no sharp object, anything that can poke and hurt other people, remove them. So for example, this is just my small organizer. Okay, I'm disappearing from the screen. There you go. That I used to carry around when I was in hand therapy. So instead of using actual knife, I'll try to use some plastic one, which is much safer. Fork two, plastic one. Okay, come on. There you go. And I like to use disposable items when it comes to, when it comes to um, choosing items for occupation-based intervention to avoid any cross-contamination from the clients. Now that we're kind of living with this whole COVID, the safe patients will also feel much safer when we're using disposable items with our clients. Not only that, have some antibacterial wipes and alcohol spray will be a good idea to have in your ADL toolbox. If you haven't already discussed with your client through your evaluation process or occupational profile process, try to identify what is really meaningful or desired occupation from your client. There are cases where your client really didn't specify this occupation during evaluation process. In that case, we can use different assessment tools like COPM or interest checklist to really identify the meaningful or desire or any occupation that might interest your client so that the compliance of hand therapy is increased as well. When choosing this occupation, try to use your clinical judgment because you don't want to just use one of the occupation that cannot be done by your client. Or sometimes your client will ask, hey, can we try this occupation? However, we already know that it's not safe for your client to do certain occupations. In those cases, don't discourage them and saying, hey, you cannot do that right now. But show them list of your occupations and say, hey, that occupation is down here. Once we clear all this, we'll try to perform or practice that occupation. So those adaptive way of your speech skill will definitely make you and your client happy for hand therapy. Always think about the just right challenge. Earlier, like I mentioned, um, always have an idea of how to do an activity analysis and how to change grade up and down using different materials, different weight. I think earlier I mentioned about the weight of different items, but something being light isn't always easier for the client. Sometimes patients with different tremor conditions, having heavier object will make the activity or occupation much easier. So always know the diagnosis and conditions of client and how to apply grade up and down and just right challenge for your client as well. Step 4 will be keep updating your ADL toolbox. So save old clothes, empty medicine jar, or empty medicine bottles and jars, and other ADL items or AIDL items too. IADL items too. Um, so that you can keep updating your ADL toolbox. I also like to visit some of the local bargain places, 99-cent store, Dollar Trees, whenever they update some of their items there. Those are my favorite places to go to update or add more stuff into my ADL toolbox. And it definitely saved me for from many, many treatment plans. And I think I got a lot of compliments too from my fieldwork educators for being creative on my treatment plans. This is just a sample picture that I used to have during my fieldwork education. The first picture is my car trunk, um, where half of the space was just filled with different ADL tools or items. It started with much smaller size of box, but after I added each items over the time, I think the box got much bigger. Um, and you cannot really carry the whole thing always to your hand therapy location because of how limited the space usually are. So definitely have some sort of a bag or organizer or container to take some of the item per day, because per day you should already have a list of your clients and your treatment plan ready. So having those tools in your car will be much helpful when it comes to having your items being ready for the day. On top of that, if you set your car trunk up like this for your fieldwork education, for example, let's say you already prepare your treatment plans, and there are always times where none of your plan works. And those cases, you can simply go to your car and bring some additional items to try different occupation-based intervention or other activities for your client. So I really encourage you guys to set this up in your car so that everything is really ready for you. Hey, um, we're gonna actually switch the screen really soon to our document so that we can look at this chart in much zoomed in perspective. So I used some of these different charts and some of the information from occupation-based practice assessment tool created by Dr. Stav and Sila. Um, and then I kind of fused those informations so that it could help the students to use during their fieldwork education in hand therapy field to promote the use of occupation-based intervention. So it will help OT students in preparing treatment plans, promote the use of occupation-based intervention, and also it could be a monitoring tool to improve the use of occupation-based intervention in your treatment plans. Give me just 1 second. Okay, so this is the zoomed in version of the chart that was in the slide. So we always want to be client centered. So the diagnosis, the precautions, contraindication, and some of the challenges or the limitation the patient might have will be on top, and then we'll choose the activity or the occupation. So it could be ADL or different, even like play or leisure activity, if that could be done on top of the table. And subcategory will be a location where you'll specify the occupation. Materials are here. So not just a one or two materials, but all the materials that you are planning to use. So these items will come from your personal ADL toolbox, or you can also ask your clients to bring some of this tool to, to actually use it in the session as well. From the activity analysis perspective, you want to identify some of the motor skills, process skill, and even social skills, so that this will also help you to understand which area the client is having issues on. And plan your grade up and grade down already, so that if the patient is having some of the difficulties in executing what you plan, then you want to change it up right away. You don't want to wait your client, nor maybe you guys will soon eventually find out your treatment session will fly by. And you always want to be prepared for every possible scenarios and situation. So have not just backup grade up and down, but backup treatment plans as well. Lastly, this point system is going to be used for your own awareness. How much of this plan was occupation-based or not? Well, okay, so I just wanted to give a credit to the framework and domain of process and the occupation-based practice assessment here. And I I basically just fill this chart. So there might be some error, but let's go through them together. So let's say there is a client who is currently experiencing from distal radius fracture on right upper extremity. Um, it's always good habit to indicate the onset date, and some of the precautions or contraindications are there. It's the challenge of the client. Let's say the flexion of the wrist is difficult, then write all those down. Activity of daily living, self-feeding, drinking water, plastic cup, paper cup, and a marker, and filled water bottle or jug. So even though maybe the actual occupation-based intervention that I planned was reach to drink, but there could be different cases where patient is already doing so well, then I want to add more challenges to it. Some of the performance skill that will be used for just drinking water. So we can change the weight of the cup, we can change the amount of the water, or we can ask the patients to pour the water. And to even further grade up, we can add some marking points, and then ask the patients to pour the water on specific amount by the labels. Grade down could be hand over hand technique if they're having some issues with grip strength, or we can give them a manual assistant as well. I think when I was filling this chart up, maybe I was looking at some of the NMES stuff, so that's just there. So for me, I gave this chart 11, and these are the considering factors when assigning points. So materials are, it could be actual occupation items or tool. It could be simulated items. So instead of using cup in a clinic, there wasn't any, I guess there should be a cup really, but if there wasn't, then maybe we can use the cones, like plastic cones, to kind of simulate the whole activity. If there is not even a cone and we're just asking this person to grab a cubical object to mimic the occupation, then we'll give this no material or irrelevant to occupation. Physical context. Is the occupation actually being done in real situation to or context, or is it the whole situation or the context simulated? Or is it irrelevant to this context, to an occupation? So most likely, or I'll say maybe little less than a half of the situation of this occupation-based intervention could possibly be simulated context because of the therapy being done in a hand therapy setting. However, if the occupation can be done on top of the table or a sink in the hand therapy clinic, then it could still be the real situation or the context. However, if it's irrelevant at all to that occupation, then we'll give a score of 1. Hmm. So the doing aspect. So we're gonna differentiate this in 4 different points where if the patient is actually doing whole sequence of an occupation, versus partial sequence of occupation, or simulated occupation, or irrelevant to that occupation whatsoever. The meaning of it. So this is when if we chose the occupation or activity by both client and therapist, then we'll give 3 points. If the activity or occupation was chosen by client because of that activity or occupation is meaningful for them, then we'll give points of 2. And if this occupation was selected by the therapist, like how I did earlier in the chart, then we'll give 1 point. And based on those point system, you could give yourself from 13 to 10, where we could define it as an occupation-based intervention. 9 to 7, this is where it's more of a simulated occupation-based intervention. And any points below to that is going to be, you could just call it either activity or task-based intervention. We'll switch our screen back to the presentation. Before we finish it up, I want to do a small reminders on and conclusion of this presentation. So when you're in fieldwork education for hand therapy clinics, um, definitely follow all instruction from your fieldwork educator or supervisor because they're the one who's going to grade you and check your performance there. Second point, use appropriate interventions for each client. So occupation-based intervention cannot be used for clients. Let's say a client who has injury of the tendon from self-cutting, from cooking, and the patient just received the surgery. Then you cannot actually do any sort of an occupation-based interventions to that client because that client will most likely be under the instruction of modified Duran protocol, which starts with passive range of motion exercises to active range of motion exercises only. So make sure know your precautions and contraindications. If you're not sure on those things, definitely reach out to your fieldwork educators if whatever you prepare for your treatment plan is okay to do or not. Occupation-based intervention has equal benefits compared to other intervention options. So if your client is appropriate individual to use occupation-based intervention, try to use it. Occupation-based intervention is not for all client. This is slightly different than the second bullet point. Some clients that I had, they were just into simple exercises because that for them that's much straightforward and used to go to the gym, so those repetitive exercise felt much better for them. In those cases, don't force them to do occupation-based interventions because they might not like the whole therapy sessions anymore. So make sure you understand what your client is like also and who you're trying to apply it to. Those are also really important points. Um, Again, create your personal ADL toolbox before your fieldwork experience begins, not just for hand therapy settings. Personally, I think as an OT student and soon to be a entry level OTs, having an ADL toolbox is such a benefit in your, I guess it's a great tool to have under your belt because you'll be always prepared or be able to come up with a backup treatment plan. So make sure to have or create a personal ADL toolbox. Equip yourself with more resources and tools, not just ADL toolbox, but reach out to your professors when you're having difficulties coming up with different treatment plan ideas, or use the library websites to look up different resources for your hand therapy treatment as well. Practice using OBI guiding and self-assessment tool to promote the use of occupation-based interventions in hand therapy setting so that when hopefully those who are here today are interested in hand therapy and are planning to become certified hand therapist one day, and I want to see the changes are happening in our future hand therapy field where we are prepared to teach upcoming generation of OT who wishes and wants to be a certified hand therapist, um, to be ready to use occupation-based intervention as well as a proper knowledge translation to them as well. I think that sums up my presentation today. The references are there in the QR code. If you guys have more questions and want to get more information from this presentation, reach out to me. There's my email. And before you guys go, I like to share just one last thing from the iLearn, I guess, department, I should say. So in the chat, I shared a link. It's a quick survey. I believe this is how the iLearn gather some of their information on how the presentations are being done. So if you guys could answer that survey, that will be really, really great. Thank you so much for your time. I'll stay around for a couple more minutes. So if you guys have questions, and if you guys can answer, I mean, ask the question through the private message as well. I used to be shy student, so I never really share my voices too in the class, so I understand. Or you can just send me an email as well. I'll also type my email here. You guys could do that. I'll really appreciate it. Thank you so much for your time again. And yeah, thank you.